The Allen's test is a test for vascular sufficiency into the hand. It's specifically testing blood flow from the radial artery and the ulnar artery. Normally, a therapist would be sitting straight on, knee to their patient, and then testing right in front of them. But for demonstration purposes, we're going to position myself beside Hillary, my model, so you can see what a response would look like. So first thing that we want to do is we want to palpate for the radial pulse. You can use 2 or 3 fingers to be able to palpate, and the radial pulse is on the lateral aspect inferior to the thenar eminence. On the medial aspect, inferior to the hypothenar eminence, is the ulnar artery. And I can feel it just in between the 2 tendons. So first thing we're going to get her to do is she's going to compress the blood all out of her hand. So we're going to do 3 pumps, 2, 3, holding the fist tight. I'm going to occlude the arteries. By pressing on them, she's going to open her hand, and to test the radial artery, she's nice and blanched. I'm going to release the radial artery. We see some nice blood supply, and now I'm going to release the ulnar artery. And you can see how the palm of her hand and her fingers got nice and red. So we're going to test the ulnar artery next. So I'm going to have her again occlude, 2, 3, holding tight. I'm going to compress over the pulses. I'm going to have her open her hand, observe for that blanching. And then I'm going to release the ulnar artery, nice blood supply in there, and then now I'm going to release the radial artery. Hillary's showing us perfect vasculature going into the palm of her hand. If she did have some kind of occlusion, or if it was a positive response, then what we would end up seeing is either continued blanching or a very slow refill. And if that happens, it's usually indicative of some kind of compression or occlusion proximal to the site, and that will require more testing. And that's the review of the Allen's test.